Okay, welcome everyone. I'd like to welcome you to a COVID question and answer session that we're going to have. Thank you so much for all of you for taking your time out of your busy day to have a conversation. I'd like to introduce Phil, who's going to start the session off.
Thank you very much, Katie. For those who I haven't had to meet, my name's Philip and I'm Katie Allen's Community Engagement Manager. A little bit about Katie Allen. She's lived locally in Higgins for 40 years, and prior to becoming a Member of Parliament, Katie was a paediatrician at the Royal Children's Hospital for 28 years. She was a professor at the University of Melbourne and the University of Manchester, and Director of Population Health Research at the Murdoch Children's Research Institute. She was elected as an inaugural fellow for the Australian Academy in Health and Medical Science and has been internationally recognised for her work at the World Health Organisation. We are delighted that Katie is available to answer your questions this evening. And tonight we've got a lot of questions, so we'll try and get through as many as we possibly can. So thank you everyone for sending through your questions.
I should just mention, Phil, that we have received, literally dozens, if not hundreds of emails by questions by email. It's been a very long week, I would say. And so any question we don't directly answer today, we will make sure that we respond to your emails with specific information. If you have questions on the chat, we will be collecting those questions on the chat, and if we can get through the first tranche of questions, because there's a lot of them, then we will get to the questions on the chat. But we will be collating and collecting questions and making sure that we get back to you either in person or by email. So thank you very much, and thank you for your respectful questioning as well. I know there's a lot of anxiety in the general community about what is going on here in Melbourne, so we will endeavour to answer all of your questions tonight to help keep you feel safe and able to be hopeful about the future ahead.
Great. So our first question tonight is from Fiona, and she's from Glen Iris. And so she asks about isolation measures and the use of family common areas. Katie, should you isolate from everyone, including family members, in case they do have the virus? And do you need to stay in separate bedrooms with the doors closed, and if possible, use separate bathrooms? She also asks about cleaning measures and the best way to disinfect your house, particularly the common areas like bathrooms.
Thanks very much, Philip. So I think the most important thing about this stage of the COVID pandemic is that we know that we have a very large amount of community transmission here in Victoria. That is because originally we had good quarantine measures which we were preventing COVID from getting into our community in any great number. Now we have a very large percentage of community transmission, so that when people have to isolate or to quarantine, it's very important that they take the important measures for isolation or quarantining. So there's not really any difference between quarantining and isolation. They're terms that are used interchangeably. It's the separation of someone who has COVID from someone who doesn't have COVID. And we also include those who we suspect might have COVID from those who don't have COVID. So when we look at home or self-isolation or quarantining, it's important to use the principles of separation of those who do or suspect to have COVID from those who don't. And if possible, if you could ensure that if you have COVID yourself, that you remain in your bedroom with your door closed but your window open, to ensure that you have a lot of fresh air circulating, and that you should use the principles of separation from the other members in your house. So obviously that means that when people come in and out of your room, if they have to, that they should wear a mask, but that you should always have 1.5 metre distance, because the point about the mask is to give a second layer of protection. But make sure you're washing hands very thoroughly, and that's a 20-second hand wash. And I've got a hand wash video on my Facebook. I can send it to anyone if they want. The one thing to think about it is you've got to wash all aspects of all the surfaces of your hands. So there's a good 20-second video that you can look online to find that. Make sure you use different utensils so that you're separating bodily fluids, because we share saliva when we're eating with other people and using different utensils. So try to use separated utensils. When you're quarantined, if you're at home on your own, you can stay in your own home, obviously, but the other people in the house need to stay separated from you. You are not allowed out of the house to go to work or to school or to the shops, but you can leave your house in order to go for medical emergencies or for medical care, and you are allowed by the Department of Health and Human Services, the Victorian State Department, to leave your house for purposes of exercising. But if you do that, we would ask that you're very careful about what you're touching, that you wear a mask when you're outside, and that you stay a good physical distance from other people. I think there are people in the community who prefer that you didn't go outside, but it's very clear that it's thought that being able to get some simple exercise is important for your mental health. The other thing about isolation is that people are a bit confused about the contact aspect of isolation. Your contacts in your house also need to self-isolate from the rest of the community for 14 days. And this is where we're seeing a lot of confusion, because what people are saying to me is, if I'm in contact with someone who does have COVID, isn't the easiest thing for me to do is just to get a test? And then I know I don't have COVID. And this is what is confusing people. The issue is there is a very long pre-symptomatic phase with COVID. So what that means is, if I have COVID and I'm in contact with someone else who doesn't have COVID, it may take 14 days for that person to develop COVID, but more importantly, it may take 14 days for the test to become positive. So there is a 14-day, what we call up to 14-day pre-symptomatic phase, and that is why isolation and quarantine is from 14 days from contact with that person. The other important thing is that people are not sure what the definition of contact is, or close contact, and that includes people you live in a house with for obvious reasons, but also someone that you have face-to-face contact of 15 minutes, or someone that you are in an enclosed space with for 2 hours or more. So that is the definition of close contact.
Great. Thanks for that, Katie. Our next question is from Sidra. And Sidra asked a little bit about the less aware symptoms. So, for example, she wants to know if we should raise more awareness about less well-known symptoms such as rashes, chilblain-like appearance on feet and hands, as well as diarrhoea. Are these things that we should be talking more about, Katie?
Look, there's no doubt that COVID can present in quite a few different ways. The most important way that it can present is with respiratory symptoms. So we do know that cough and fever and sore throat and the runny nose are the symptoms that we most closely associate with COVID. There's some very interesting technical symptoms, which in about 30% of cases, people lose their sense of smell or even their sense of taste. And that's an unusual symptom because it's not seen in the flu. People can also get diarrhea as the virus gets into the gastrointestinal tract, and there are some less common symptoms as well. But what we suggest to people is it's very important that if you have any symptoms at all, that you should seek help from your doctor, and then they can help decide, do you need a test because the symptoms may be COVID, or do you need to be given support in some other way? Because what we are finding with this COVID crisis is particularly the older population are concerned about going to their GP, they're concerned about going to the healthcare system for other medical conditions because they're worried about getting COVID. And that's why I'm very proud of the fact that our federal government has rolled out this wonderful telehealth program, which means that you can ring your local general practitioner and get a telehealth or a telemedicine appointment, and then you can ask your doctor about your signs and symptoms, even show them any new signs or symptoms that you may have, and you can keep control of your chronic health disease if you have one as well. Make sure you get your scripts up to date and look after your other health conditions or even mental health conditions. And we do know there are a lot of people who are very anxious about this COVID pandemic. They're also aggravating some of their other conditions because of depression and anxiety. So we do ask people to seek help, whether it's mental health through online measures. So there's Lifeline, Beyond Blue. There's lots of help programs that are out there for those who are suffering from anxiety or depression in these difficult times, or your GP can direct you to those services and make sure that you're keeping your other health conditions up to date. So any questions at all, the most important thing to do is to ring your GP and ask for a telemedicine interview so that then you can work out what to do next. Importantly, if you do think you have symptoms of COVID, please do go and get tested. There are many free COVID testing places in Higgins, and we can provide that for you. The most obvious several include the Prahran Town Hall, which is in Chapel Street, and I was the first person down there. Not that I got tested, but before they opened, I went down to check out the facilities there back in March. Very pleased to say they're very high standard. You can book online so that you can go along at a time that suits you. and then they have very good separation of people so that there's no risks when you're down there, and have very good hygienic and good infection control so that you can get tested. And then there's also, I think it's the East Malvern Golf Club has a drive-through testing, which can be very helpful for older citizens who have a car but don't want to actually leave their car. So there are lots of opportunities to get tested. Do remember, if you have to go and get tested, or you're concerned and you need to go and get tested, wear a mask as you do when you have to go outside. But if you're going to your GPs, call ahead, because they need to know that you're coming in if you think that you do have COVID.
Thanks very much, Katie. Our next question is from Noriko, and she's from Ashburton. Noriko is an aged care worker, and her question is, what measures should I and other aged care workers do to protect ourselves and our patients other than wearing PPE, given they are not COVID-proof? Social distancing in our workplace is virtually impossible, as it is in other environments such as schools.
Thank you very much, Phil. This is a very important question, because I think people are trying to work out how it is that they can keep physical distancing and keep their infection control under control when they're in the workplace, particularly those who are working in our aged care sector and our healthcare sector. It's important to note that we are very concerned about the outbreak in our aged care facilities. We do know when there's a large community transmission. I've lost where the meeting thing comes on. Participants, here we go. Sorry, just want to make sure I'm muting everyone. Here, someone's waiting at me. Sorry. So we do want to make sure that in your workplace that you are kept safe. And that is because we know that the aged care facilities has an increase of difficulties with people who actually have COVID. We know aged care residents are developing COVID, as it does happen with community outbreak. It is worth mentioning that the highest prevalence of COVID outbreak is actually in the younger age population, between 20 and 30. We're not sure why that is, and actually amongst females. My guess, it may be because young females are more likely to be in public-facing jobs, and that's why they're more exposed to COVID. It's not very clear from the results. But what we're most concerned about with the older population in our communities, they are, of course, at the most risk, unfortunately, of getting sick and going to hospital and potentially going to intensive care and potentially, unfortunately, dying. So that's why we're all very, very worried about what's happening in the aged care environment. But it is important to know that there is a large number of healthcare workers and aged care workers who are also getting COVID. And this is not through any fault of their own. It's just because we know that in the community there is very widespread community transmission, and it can happen amongst the asymptomatic people as well. So I'd like to give a shout out to anyone who's on the line who's an aged care worker or a healthcare worker. You're doing an amazing job. And I know that you all have very good ideas about how to safely care for people in the workplace that you are at, and that through no fault of your own, you may have actually been exposed in the community and developed COVID yourself. And we are hearing reports of healthcare workers and aged care workers feeling very stressed by the exposures that they may be getting to COVID in the general community and the risks that they're taking. But the important thing is, in the workplace, for aged care workers or healthcare workers, physical distancing does remain important, but when you can't physical distance, that we are making sure that there is enough PPE, and there's a federal government initiative to ensure that there is enough personal protective equipment, masks and gowns available for aged care services. And if there's any aged care workers who feel locally they're not getting what they need, please let me know as your local member. But we are very pleased to announce that there is now a dedicated Victorian Aged Care Response Centre to make sure there is enough PPE equipment for all of the aged care services across Victoria, and particularly, of course, here in Higgins. And the other thing that's really important is, because, as I mentioned before, we know that there's a lot of healthcare workers and aged care workers who themselves are developing COVID, and then that they are put on furlough because they need to work from home, or, be at home rather than at work. It's putting a lot of pressure on rostering. So there's a secondary consequence to our healthcare and aged care sector, where making sure there's enough unfurloughed workers, or workers who don't themselves have COVID or are in isolation because they live with someone who has COVID, and that is putting a lot of rostering pressure onto the system. And we need this rapid response for rostering to make sure that there's 24-hour, 7 days a week support and care for both our aged care sector and the healthcare sector. And that is why the Prime Minister is dedicating himself to this problem. And you'll probably be pleased to know that Brendan Murphy, who has been the Chief Health Officer or Chief Medical Officer of Australia, has moved to the Federal Secretary of the Department of Health, and he has taken a very keen and personal interest in ensuring the aged care sector here in Victoria gets all of the necessary support. I will say that there is one other aspect that is very interesting, and that is that there is a new novel piece of equipment that is being developed here in Australia that is being rolled out in hospitals, particularly for those healthcare workers who are working very closely with patients with COVID. They, of course, have to wear PPE equipment themselves, but working with patients who are ventilated can be quite difficult because the ventilators result in respiratory droplets, which we know is a form of COVID being spread. And there is now a new technical piece of equipment that's like a plastic bubble that is being used to protect our healthcare workers from the droplets that occurs from the intensive care environment. I also want to give a shout out to our amazing medical health professionals, our doctors, our nurses, our allied health workers who are doing an amazing job, and to say that across the world there has been quite serious mortality rates or death rates amongst those unfortunate COVID patients who have to go to the intensive care. But in Australia, because of the great work by our medical professionals, that mortality rate is lower than anywhere else in the world as far as I know. So the global rates of mortality, once you get to intensive care, you had more odds of dying than not dying around the world, except here in Australia. So it's between 60 and 75% mortality rates in the rest of the world, but in Australia it's down to 15%. And that's from a number of reasons. Firstly, because we have a good healthcare system with top quality nurses and doctors and allied health professionals, but they are using very good protocols, which includes special forms of ventilation which are less invasive and less aggressive, which seems to be more effective and less harmful. They are also using steroids, which is very important to dampen down inflammation, and they're also using antiviral drugs, and they've also recognised the other organs that are involved in coronavirus if it does become very serious. So, I think it's encouraging for all of us that we're worried about the community transmission, but that we have a excellent healthcare system that if you're unfortunate enough to go to hospital or unfortunate enough to be in intensive care, the protocols are the best in the world. And we should give a shout out to the Federal Minister of Health, Greg Hunt, and all of that work that he has been doing, ably assisted by the Chief Scientific Officer, Alan Finkel, to enable our intensive care ventilator capacity to increase from 2,200 beds to 7,500 beds across Australia. So we're in a good position as we go forward, but it is worth mentioning those key points.
It's a great answer there, Katie. We're actually getting some really good questions coming through the chat, so please keep them coming. We've got one from Antonia, and she asks where she can go and get the daily cases. She's a Stonnington resident and wants to know where she can get the daily cases of outbreaks. Is there a website she can go to, or can she, the DHH website, is that one?
Yeah, so the DHHS website provides a daily update. A lot of the newspapers also provide a daily update. So if you've got an online newspaper subscription, which you can, if you have someone in your family, might be able to help you to download that app, and that's very helpful. There's also a website called NCOV Live, ncov.live, which is actually live data from around the world. It gives you Australia's numbers, Australia's state and territory numbers, but also gives you every country in the world, both the case rate and the mortality rate. So there is a lot of online information, but the DHHS website can provide that for you in Victoria.
Awesome. Thanks for that, Katie. Our next question is from Eva from Malvern, and she asks about face masks and whether wearing a face shield or face mask is safer.
So there's a lot of conversation about the use of masks and face masks and shields. And the difficulty is that at the end of the day, the quality of the mask increases the quality of the protection. So we know that single-ply masks are the lowest quality, but they are better than nothing. And so it's, I don't know if any of you have seen some very descriptive videos where people show the expulsion from a sneeze or a cough, and then the different qualities of masks that are being used. So the single-ply masks The cheap ones, dare I say it, from China are not good quality, so it's very important that you try and try and achieve a minimum standard of a 3-ply mask. That's the most important one, so 3 layers mask, whether it's fabric or disposable. There are reusable masks and there are disposable masks. I prefer a reusable mask myself just because, I mean, I don't have COVID for a start, but for the general population, I think a reusable mask is better. It's more cost effective. You can wash it every night, but also it's going to be less wasteful. And we also want to make sure we try and keep our reusable masks available for the healthcare and the aged care sector where they need to use a high volume turnover of masks because they're in a higher risk environment. So I prefer to use a reusable mask myself, and it has to be 3 layers of fabric. Again, we can post online where you can order these masks from. I've got a mask right here, and just to show you that masks, and I'm going to touch this mask just so that I can show you, but a mask has a top and a bottom. Some people don't realise that, but the top has a little bendy bit in it, and that is so that it can fit snugly over your nose and to pull the mask over your chin. You're not meant to touch the mask, but I'm just showing you for the purposes of this. You're meant to hold it by the earpiece, and you put it on and put it off with the earpiece. The outside bit is obviously the part that will have the virus particles, so you must be careful not to touch that mask unless you yourself have COVID, in which case the virus particles are on the inside. So it depends whether you're wearing it to prevent other people from getting COVID or you're protecting yourself from COVID. But if a mask becomes wet, then you do need to take it off and either replace it with another reusable or replace it with a disposable. It's very important you wash your hands before and after you put your mask on, so that if you are touching it and getting COVID onto your hands, that you are not then infecting yourself. And the one thing about masks is that if you're touching it all the time, you're actually defeating the purpose of it. So please try not to touch the mask, because the mask is the bit that's carrying the viral particles. I have had a lot of questions from people about wearing masks with glasses, and a medical friend of mine gave me a very good little trick, and that is to buy some surgical tape from your pharmacy, and then you can put it across the top of your cheeks. And it's to stop the air going up and fogging up your glasses. Another good trick is just to make sure it's snugly fitted across your nose, and just give a little gentle pull on the bottom of the chin when you put it on, and then the air will be directed downwards, because the reason that your glasses mist up is because the air is going upwards. It's probably worth pointing out that there are exemptions for people to wear masks, and those include people who have respiratory difficulties, because obviously that will complicate their healthcare. Those who have significant mental health issues, some people may have phobias about masks, so they are also exempt. Children under the age of 12 are exempt from wearing a mask, though they are encouraged to wear a mask under the age of 12. They won't be fined if they're not wearing a mask, and children under the age of 2 are not allowed or asked to wear a mask because it's regarded as too dangerous, because they're too small and they may have respiratory problems. You are also exempt from wearing a mask when you're running outside, so as part of your exercise, if you're having to breathe very heavily, because it'll obviously interfere with breathing. I have had a lot of residents saying that doesn't seem fair that people are able to run without masks, but it is a safety issue. And I've also had a huge amount of people who are very distressed by runners who are coughing and running and breathing and spreading. There is no easy answer for this. We do need to be respectful of each other and each other's space. Do remember that the contact is 15 minutes, though. I mean, I don't think anyone would doubt that if you're being coughed on by a runner running past who's got COVID, that's a pretty dangerous situation. So what I would suggest is using your common sense. Try to avoid, if possible, an environment where you are exposed to runners going past, because I think that's a way to minimise it. And the one thing about Higgins is there are lots of lovely parklands. My husband and I go walking after dinner at night, because I'm very busy during the day. I'm sure many of you are as well. But there's not many people out at night time. That's how we get our exercise. We're not having to elbow other runners. So we go out with our masks on, take our dog for a walk quite late at night. But walking through the streets, not a lot of traffic, and it can be quite pleasant. So there's other practical ways to try and avoid people who are running, but I do understand that it can be a bit distressing watching someone coughing and wheezing and running past you when they're not wearing a mask. So if someone has any coughing, I think they shouldn't be running anyway, and they should be managing their asthma a bit better if that's causing them coughing.
Lovely. Thank you, Katie. Our next question is from Yvonne, and she asks, are grandparents considered caregivers and as such permitted to babysit?
The simple answer is there are 4 exemptions for why you can leave home from at this point in time in stage 3 lockdown. So you're allowed to leave home for the purposes of work or school, for getting essential goods such as groceries, for exercise as just discussed before, and then the 4th one is for caring duties. Now, we've searched the website pretty thoroughly to find what the definition of caring duties are. It's care for yourself, so that means medical care. If you have to go to the doctors or you've got requirements for your own physical or mental health, but it's also caring of other people. So if you've got a relative who is sick or is in quarantine and you need to drop food at their door, or if you have grandchildren that you have to supervise because they need care, then that is appropriate from what we can gather. But we cannot find the formal response from the department, and if anyone would like a more formal response, I'm happy to advocate to the State Department with regards to more formal response. It is worth saying that when we spoke to the police station in Malvern about some of the questions about mandatory mask wearing, the police station at Malvern told us that if in doubt, use your common sense, but there is also a COVID hotline that can be called for any questions about mask wearing and whether you are exempt or not, or whether you're allowed to be out. So for any clarification about questions, the hotline, the COVID hotline to call is 1800 675 398. That's 1800 675 398. And that's the way to get the best information straight from the department's mouth, so to speak.
Great, thanks, Katie. We're actually getting some more questions just coming through online, so I'll just quickly read another one for you. Should we feel confident to attend major surgery, or should we try and delay that surgery?
That's an excellent question, and I think at this point in time, the most important thing to realise is that the hospitals themselves are very, very good at managing their infection control. So there's not any evidence that people are getting COVID from going to a hospital. So if you have health issues that your GP or your specialist recommends that you attend a hospital for any procedure, then I think you should follow that medical directive. It is worth saying that even though there are 5,600 active cases in Melbourne and Greater Victoria, the vast majority of those are not in hospital. The vast majority of those will be at home. Hopefully all of them will be at home. And then there's expected about 20% of those will be symptomatic enough to think about or require hospitalisation. So if you think about that, that's about 1,000 people across all of the hospitals in Victoria. That's not a large number. In fact, it's probably a lot less than that. In fact, I think it's only 300 from memory who are actually in hospital. I'm sorry, I've got the number a little bit out of whack. There's 300 people who are in hospital at the moment with COVID across all of the hospitals in Melbourne. So that's a very low caseload in a particular hospital. I know myself at our local Higgins Hospital, we have the Cabrini Hospital, which is a private hospital, but also the Alfred Hospital, which is the closest public hospital just outside of Higgins in McNamara across Punt Road. And I know that at last count, Cabrini had 4 cases of coronavirus. So it's a very low caseload. So they really do know how to manage these cases. They're very careful about making sure they're separated from other people. So the risks of going to hospital and getting COVID are very low at this point in time. But that being said, there is a change to requirements for elective surgery that have been rolled out by the state government. So non-urgent elective surgery has been cancelled at this point in time, and that is to make sure that we have all of our health services ready and available if we were to get a surge in cases presenting to hospital and in particularly into the intensive care. So if you have the opportunity to get your treatment and it is allowed to happen, then I would certainly support that happening.
Thanks, Katie. So Rudy from Malvern East asks about the active cells that are appearing in meat processing. Can the virus survive on raw meat, and can any person handling the meat before it's cooked become infected? A similar issue with fruit and vegetables. Do we know anything about that?
Look, there's a little bit of variation in the epidemiological information about this. There is a lot of concern by some community members about COVID surviving for long periods of time on inert surfaces. So that includes products from the supermarket, fruit and vegetables, And there are people who bring those things home and put them into quarantine before they eat them. There isn't a lot of evidence for that being a problem at this point in time. And in fact, there is most people think that isn't a necessary step. But the only exception to that may be if it's in these outbreaks in meat and processing environments. And it's not thought that it's necessarily in the meat, but that the fact that it's coming from hotspots where the meat may be coming from the workers that are accompanying the meat, and that it may well be that the workers are in close contact for long periods of time in a cold environment, and they're in close contact when the temperature is lower. That's allowing more easily spread through the abattoir system. So I don't think there's any evidence that it's in the fresh meat itself. And we do cook our meat, so that's a way to destroy the virus anyway. But I don't think there's much evidence for that at this point in time. But it is something that I'm always keeping an eye on with regards to the research evidence. But I think it's human-to-human contact seems to be the main way that it's actually contracted, and that's by respiratory droplets.
Along the same vein, Katie, Rudy also asked about filling up your car at the petrol station. Is it dangerous to touch the nozzle, given so many people touch that?
Look, in Hong Kong, which is a place that's been doing very well, in fact, possibly not so well more recently, they're having a bit more difficulty more recently, but they've been doing very well through the pandemic. And the argument is because they've had SARS and they've also had a lot of flu pandemics. As a population, I've got friends up there, I'm sure other people on the call do as well, that they are very good at using physical distancing, hand sanitising and masks, and they've been doing that throughout the pandemic. But I have friends who, when they say it's just normal in Hong Kong that you have hand sanitizer in the car, you use it before you go to the petrol station, and then you actually either use a glove or hand sanitize after using petrol pumps, because they think that that's an important practical step to help keep you safe. So it seems a not unreasonable step, just like when we go to the supermarket, that you should hand sanitize the trolleys and the baskets before you use them to make sure that you try and prevent the spread. Again, there's not a lot of evidence for or against it, but I think it's a simple thing just to try and keep you safe.
Great. So Nerida from Stonnington also asks a little bit about, do we know if there's any coronavirus circulating in high-rise precincts in Stonnington, similar to the situation we've seen recently?
Thanks, Phil. I've been down firstly to visit the high-rise houses about 6 weeks ago, and then again 4 weeks ago, just to sort of meet with residents and to see how they're feeling about information being passed to them, and whether they're feeling comfortable about cleaning that's taking place and about communal environments. And I got the impression that they were well educated, that they knew mostly what was going on. But then I've had a meeting subsequently with Stonnington Council, and they've told me that they're spending time communicating with the residents in the towers to make sure that they've got the information they need about how to stay safe, where the closest testing place is, and to make sure to know which services to reach out to if they need to. So look, we do know that this virus is indiscriminate. It's indiscriminate depending on gender, your age, where you live, and being careful and taking all precautions is very, very important. There's a lot of work that the federal government and the state government have done in reaching out to multicultural groups and those with English as a non-English speaking background. We've invested $30 million in ensuring that all of the information is about COVID is being translated into the 63 different languages that are used commonly across Australia. We did that with SBS, and then we made sure that all social media and media platforms have had COVID information that's made available in these different languages. But more than that, it's not just about providing information, it's about making sure that the community leaders themselves are aware of how to support their own community, that those who don't have English are exposed to the information that's required. Word of mouth, we know, is very powerful in any community, just as equally in those from culturally and linguistically diverse communities as in those who are not culturally and linguistically diverse. So it's very important that word of mouth continues. We're doing word of mouth right here. And we know that the culturally and linguistically diverse communities will often have large families where they can, where communication is very important, or that they are going to places of faith, temples and churches and mosques that are no longer open. So we know that they're most likely to have some idea of what's going on, and hopefully the community leaders are able to provide lots of support for those people. The Minister for Immigration, Alan Tudge, has had over 200 roundtables with community leaders across Australia, and we know that there's been 1,000 meetings from the department with different community leaders. So there's a lot of work being done to make sure that we're supporting those from immigrant backgrounds who may not have English as a first language.
Great. Thank you, Katie. We're getting a lot of questions coming through about children attending preschool and schools, and particularly given that children are considered lower risk. Is that still the case, and is that going to be a concern for essential and frontline workers?
Look, I have always been an advocate for schools to remain open and childcare centres as well. Now, people would say, you're a paediatrician, why is that? And that is because this COVID is very different from all typical flu and, in fact, all other respiratory conditions with regards to its predilection for the young. It doesn't seem to have a particular predilection for being a reservoir in young children. We don't know why that is. There is some research to suggest that the receptor sites for the virus are not as well developed, particularly in the very young. That's not to say children can't get COVID, and we do know there are cases of COVID in the young, but those cases don't really increase until after the age of 18, really, and the less than age in 18 seems to have a smaller prevalence than in other age groups for whatever reason. Yet we know children crowd together and they share fluids, and so there's something unusual and unique about children. So that's not to say we don't want to take all precautions, because of course who knows which child will develop COVID, and we want to make sure that they're staying safe. But we also know that child's education is incredibly important. These children are our next generation, and we don't want them to lose a year from school. We want them to be gainfully educated and socialising and developing, and it's very important that the risk of them getting COVID seems firstly a bit lower, but also the risk of dying from COVID is a lot lower, like order of magnitude lower, 2 orders of magnitude lower than for older generations. So it's important that these children, I think, do go to school. I know it can be frightening for parents that they're fearful for their child, but in fact it's the parents and the grandparents that are more at risk, and we should keep particularly young children away from our older generation because we want to keep them safe and sound.
Great. We're getting some really good questions. Please keep sending them through. The next one's from Michael Holwell, and he asks a question that I think we're all very concerned about. And what is the rights of parents in aged care if they contract COVID and if they have to be moved to another hospital? What are the rights of the family members?
Yes, so it's very important that with aged care, I've had a lot of interaction with different aged care facilities in the way that they're interacting with families, particularly extended families. It can be very distressing for those families who want contact with their loved ones in an aged care facility. I know how frustrating some of the requirements have been for aged care facility lockdowns, and how that's been very distressing, particularly when a loved one has Alzheimer's and is confused and doesn't know, what day of the week it is or who it is that's coming to see them. And I know people have written very heart-rending stories to me about the fact they're worried they may never see their parents again. And I have heard of people, unfortunately, who've actually died alone in a hospital because the rules of the hospital are that no one can visit someone in those last days when they are very, very sick. So this is very distressing for everyone, and I know that the guidelines are very restrictive and worrisome and frightening for families. So I really feel for those families who have parents in aged care homes or who are going to hospitals, and how difficult this can be. There's no simple answer for this. It's usually on a bit of a case-by-case basis. But what I will say is, for the good of the system, for the good of the families, and for the good of the person themselves, it's been recommended that each family nominates one person as the link person. And that is true when people are very sick in hospital. The medical professionals prefer to communicate through one person, because that means that the doctor, instead of having to communicate with everybody and then someone feels left out, there's one person who's the central point of communication. And I think that in this rapidly changing time, when we know aged care services and healthcare services are stretched, I hope that everyone's tolerant and forgiving of a very stressed system from the point of view of the support that is able to be provided, that a key person should be nominated as the communication point for that person. And if they need to be moved to a hospital for the good of their health, that is supported. And I do know that Cabrini has accepted a number of people from a nursing home in the north. I think there were 15 people being transferred recently from a nursing home to support them. So there are a lot of hospitals now stepping up to provide support for people in different nursing homes as we go through this transition of a stressing to the system with regards to those who have COVID and those, unfortunately, who are being furloughed because they've had contact with COVID.
Great answer. So we've got a question from Gabby from Malvern. She asks about the current large number of new daily cases, and obviously today we had a very large number. How long might it take to drop back to a level where lockdown restrictions might be lifted somewhat?
Thank you. Look, this is this sort of $64 million question, and of course we're all hoping that this is over as quickly as possible. I think that at this point in time it is very hard to predict the future. But what I will say is I've been in contact with my colleagues all around the world, and there will be an end to this. There is a light at the end of the tunnel. It's just a matter of how long do we have to wait. It is worth saying that I think that Australia's approach has been the right approach, and that is that we are quarantining ourselves from the rest of the world, and that very early on in this COVID pandemic we took very significant and early on steps that were criticised internationally by quarantining from hotspots. And I think that has been the most important public health measure that we have taken as a nation, that when people were returning home from Wuhan, Australian Chinese were returning home from Wuhan, that they were willing to undergo quarantining on Christmas Island. It was so there was some criticism from people internationally about doing that. It's now well regarded as an important public health first response. And we also quarantined those who were on the Diamond Princess, and we had 4 constituents from Higgins that were on the Diamond Princess, and I was in contact with them every day those 14 days they were on the vessel, and then the 14 days that we came down into Howard Springs for support. And those people willingly went into quarantine early on in this pandemic, and that is actually why we had a very good start to this pandemic, and we didn't have the problems that other countries have had. I will say that going forward, that has been working for us. We have had, in February alone, we had 35,000 Australian Chinese returning from China. So most people don't realise that we actually had a big exposure to the pandemic very early on, but our early and initial steps were strong, they were certain, and they actually had a very good outcome. It's also worth saying that Australia was one of the first countries, if not the first country, to call this a pandemic, and in fact it was 2 weeks ahead of the WHO calling this a pandemic. So our first steps were the right steps. Our view was to flatten the curve so that we could prepare our healthcare system, aware that we had a lot of people continuing to return from overseas, and that we then quickly and swiftly put in hotel quarantining, because of course the quarantining for Christmas Island was going to be swiftly overwhelmed if we didn't put in place hotel quarantining for returning travellers. We have had 375,000 Australians returning to Australia. That is thousands of people, and 7 out of the 8 territories and states have done well, they haven't all quarantined, but the major states that have been quarantining have done it safely and effectively. I know many of you, and I know myself, we're deeply disappointed about the quarantining failure here in Victoria. It is what it is. I've called for there to be an inquiry ongoing, and the National Cabinet is looking at this so that other states don't make our mistakes. That's the most important thing, in my view, about why we need to know what went wrong, not because it's about finger pointing, but that we need to make sure that it doesn't happen in the other states, because Victoria has now passed on our quarantining responsibilities to the other states. The Prime Minister has capped quarantining capabilities because we're worried that we don't want to overwhelm the other states. Maybe that was the problem here in Victoria, we don't know. So New South Wales has a cap of 3,000 cases, and I think Queensland and South Australia have 500 cases per week that they're allowed to quarantine, which I think is a good thing. But then the second step about safety from this pandemic is the tracking and tracing. And I've been a bit disappointed that we haven't had an acceptance of the request by the federal government to provide support until quite recently for that tracking and tracing. We did ask, I think 5 weeks ago, to provide ADF support for logistics, because tracking and tracing is very sophisticated and it needs military precision. I'm pleased to say that the ADF is now on board, and we have a large amount of people involved in tracking and tracing, and there's a very focused mind about getting the tracking and tracing right. And then the last thing, of course, is making sure that we get the community on board with the messaging about, firstly, how to physically distance, what to do with regards to stage 3 lockdown, making sure that people are using mandatory masks in the right way, and then lastly, for them to understand the isolation measures and how important they are.
Great. So we've got a question through from Barry, and he asks about the capacity for beds at Alfred and Cabrini. Are we sure that we're on the right track with the capacity and capabilities there at those hospitals?
Yes, I went down on, I think, March the 2nd, early on in this pandemic, and to inspect the facilities of both the Alfred Hospital and Cabrini, and I've been in contact in an ongoing manner with both of those hospitals. Top quality hospitals. I would feel very comfortable for anyone either to get their testing done, or if they have any health concerns, to go to either of those hospitals, private in one case and public in the other. Cabrini has also taken on some public health responsibilities. The Minister for Health, Greg Hunt, has brokered a deal between the states and federal governments to ensure that there is a capacity for the public and private health system to share across the two parts of the system. It's a very welcome collaboration to make sure that any redundant, any sort of capabilities in the system is opened from the public system into the private system. So the private system is definitely coming into support for the public system as well. So the state governments have now bought beds in the private hospitals to make sure that there's capacity to increase. So we definitely have capacity. I've lost count of exactly how many numbers of intensive care beds there are at each centre, but when I was down there in March, I think the Alfred Hospital had increased from 45 to 75, and that was very early on. And I know the Cabrini Hospital's opened a whole ward for intensive care. So they're both well below capacity. They've got huge amounts of redundancy in the system to enable them to use the capacity that they have developed. It's important that you need both the equipment for ventilators, and as I mentioned before, Alan Finkel, the Chief Scientific Officer, has spent a lot of time working with engineers and repurposing equipment, buying equipment and making equipment here in Australia so that the ventilator capacity is ready to rock and roll, so to speak. But the other thing that's important is the ability for trained staff to use the equipment for the ventilator bed. Some people forget that a ventilator has to be managed 24 hours a day. So it's not one nurse per ventilator, it's 3 nurses, 3 shifts of 8 hours per ventilator. So for every bed that we have to increase the capability of the medical support staff as well. And again, Greg Hunt has been working very closely with bringing new trainees into the system and training them up and upskilling them, as well as working with the colleges to make sure that we have all of the skilled workforce ready and willing to act if need be.
Great, thanks, Katie. We've got a question from Trevor from Hughesdale, and his daughter is an NDIS participant. He's currently paying for her masks and other protective equipment, but given he and his wife are currently struggling a little bit financially and this added expense of having a mask, how can we help people like him and his family?
Thank you. I'm pleased to say that the Minister for the NDIS, Stuart Roberts, has recognised that there is increased requirement for PPE or personal protective equipment for those with a disability. So there's been a change to the arrangements of the NDIS so that it now incorporates the ability for the NDIS payments to pay for PPE equipment. And I think everyone knows that the federal government's now supplying millions and millions of masks and PPE equipment across the disability sector, the healthcare sector, and now the aged care sector.
Great. And Morris has...
I should also say that there's been a lot of work with by the Minister for Industry, Science and Innovation, Karen Andrews, to increase our capacity for PPE equipment. A lot of people have been rightfully concerned about our supply chain, and early on in the epidemic, I was working very closely through my connections with medical diagnostics, medicines, and also PPE, and some of the critical supply chain issues that we had early on. They've been all worked through with procurement. There's a very strong procurement process with the federal government. We have some local experts in Higgins, actually, who do importing of important drugs to this country, and we actually had to escalate it up to the Prime Minister to talk to the Prime Minister in India in order to make sure that those supply chains were consistent and opened up, because there was some I have to say there was some global competition around critical supplies, including medicines and PPE and diagnostics and test kits, that Australia is able to win. And so that's a very good outcome for Australia. And I think we should be very grateful that our executive has worked so hard night and day to make sure that those supply chains, those global supply chains, have helped be maintained so that Australia has access to essential medical supplies. But on top of that, we've been working hard to increase our own sovereign capacity, particularly with regards to PPE and toilet paper, by the way. So there's been work done on all of these things to make sure that we've ramped up local capacity for mask production. There's one in Shepparton and one in Adelaide that's increased from a capacity of a few million to many tens of millions of masks. In fact, hundreds of millions of masks that are now going to be produced locally. So I think that's a good thing for Australia, and we should be pretty pleased with some of the nimble pivoting that our companies have done. For instance, some of the gin companies have pivoted to production of hand sanitizer, which is a good thing as well. So I think Australian companies have really done a great job responding to the needs of the Australian consumer.
Great. We've got quite a few more questions coming through, but I just want to remind everybody, if we don't get to your question tonight, please send us an email to Katie Allen's email address, and we're happy to put that into the chat for you very soon. But we do have a couple more questions. Katie, can you explain to us a little bit about the new rapid testing example, the saliva testing, and how that's going, the new rollout?
Yeah, thank you. So there are lots of different tests that are available. There's a test that actually measures your viral load, so how much virus is in your nose and in your respiratory tract, and that's a nasal test, and it's testing via something called PCR for the presence of the virus, which is an RNA virus. That's the type of virus that it is. And then there's another type of test, which is a blood test, which is testing for your immune response to see whether you have mounted what we call antibodies and that you are immune. And there's a lot of research going on about the second type of testing, the antibody testing, to see whether someone has developed immunity. And again, speaking with my international colleagues, there had been a lot of hope that either people would build natural immunity to the point of 70 or 80% of people having immunity, which is called herd immunity, and that would protect the general community. And that's what Sweden has attempted to do. The disappointing thing about Sweden is that it's estimated probably only 17 to 20% of people have developed natural immunity. And in the UK, they looked in their healthcare workers, where there's a very big outbreak in the UK, and only 30% of even healthcare workers who are very exposed to COVID have developed antibodies. And then a month later, they found that had dwindled to 10%. So there's two aspects about herd immunity. Firstly, we don't seem to be able to get it up to the levels where natural immunity will be useful. And secondly, it seems that the antibodies may disappear after a short period of time, which suggests that long-term immunity might be harder to activate. So the other type of testing, getting back to the original question, is this question about looking for the virus itself. And at the moment, the test is done by putting a test into the nose, or if you can't get into the nose, into the back of the throat. And some people are looking at saliva tests for the presence of the RNA. And there's two types of tests. There's one that is called, which is a laboratory test where the sample gets sent off to the laboratory, and it can be tested in about 8 hours if everything is very fast. And so because we have such a high volume of tests being done in the tens of thousands each day, it's taking between 1 and 3 days to return. In fact, I'm hearing from constituents, unfortunately, that some people are finding it's taking 8 days to return. So I will tell you that the Minister for Health has just commissioned someone, and I won't say who it is because it's not official yet, but there is someone who has been commissioned to sort this out very quickly. So there's a lot of work being done to make sure that the testing response for the longhand test, the lab-based test, comes back to 2 days more reliably, because some people are waiting up to 8 days to get their test result, which means their life is being put on hold and all their contacts' lives are being put on hold while everyone waits to see whether the test for that particular case is positive. Now, there is this new test that has been developed as a rapid test. It only takes 15 minutes, and it's based on a gene expert methodology, and it's actually a company called Kefid who produces this, and the cartridges are in very short supply to do this test, and Australia only has a certain access to a certain number of these tests, and we have got full access for our country that we can get, and I've asked for those to be diverted to Victoria. So I can't go into too much detail about that, but just to know that when we can test quickly and we need to test quickly, we are. But I'm also pushing very hard to make sure we get as much access to this quick and responses testing as we can, because it does help for people to know as soon as possible when they do need to quarantine and when they are at risk, because that helps contain it in the rest of the community.
Great. We've got 2 more questions before we wind up for the night. Gail from Malvern asks about handling of groceries and other products that she brings into the house. Should she be wiping all these down? And is there any other recommendations you might have about protecting your family from products that you bring into the home?
Yes, look, I think everyone should take a decision about the way they see their risk, for themselves, because everyone, views risk in a different way. And, the bare minimum is, social distancing, hand hygiene, and wearing a mask. Those are the 3 things we know work. They're effective and everyone should do them. And staying home, of course, unless you're going out for the essential activities that have been outlined by the state, which is going to school or work, essential shopping, caring for yourself or for others, or exercising. But with regards to grocery shopping, some people do like to take the next step. And, if you have the time and you have the interest in doing that, of course, there's not going to be any harm. So, of course, do no harm is a first principle, but there isn't a lot of evidence that you need to do that. I do know some people are doing that, and if that's what makes you feel more calm and less anxious, then that's obviously something that's going to help you. But there isn't any strict public health recommendation that you need to do that at this point in time. I do know that when people have been outside, washing your clothes in hot water can be an extra step. Some people do like to take that extra step. Again, it's not regarded as necessary, but of course, probably wouldn't hurt to do more washing than less, just to have an extra layer of safety if that's what makes you feel less anxious and more hopeful about our future.
We've got time for one more question, and it's from Angela from Malvern. And she asks about the government's plan to live with COVID moving forward. How do we integrate COVID into our lives, Katie, so we continue to live our normal lives?
Thank you. Look, I have to say it is hard when we have such high caseload to feel comfortable that we're in control of this pandemic. And I know Melburnians in particular, but Victorians are worried about the future. I do know that we will come down the other side of this curve. I know that there's a lot of work in the system. It takes a while for the lag to catch up for us to know that we're on top of this. It will happen, and it's just a matter of time. And hopefully the work that's being put together now is going to take us to that next step. There are 3 outcomes. The first one is that we live with this virus until the point that we find a vaccine. We live with this virus and we develop herd immunity, or we live with this virus and it peters itself out. I think they're the 3 only outcomes that are possible. Most people don't talk about the third outcome. With the first outcome, I believe a vaccine is further away than the scientists like us to think, and I think it's important that we provide research funding and invest in hope. But I think the point about a vaccine is we need to know it works, and even if we have a vaccine and we know there's 115 vaccines that are in progress at the moment, even if it does work, it may only be 30 or 40% effective. So we need a good virus as a good vaccine that's almost 100% effective. And even if it's effective, it needs to be safe. And there are some vaccines that are produced by the medical fraternity that end up being unsafe and therefore have to be discarded. So it has to be effective, has to be safe, and then on top of that, it needs to be produced in large quantities and distributed globally. So there's a lot of stuff that needs to happen before we can get to a safe and effective vaccine. We also know that the technologies that are being used have to be new technologies because we've not been able to find a coronavirus previously for vaccines. That being said, if there's going to be a vaccine found, it'll be found because there are 115 vaccine trials that are going on. So if it's humanly possible, I'm sure there'll be one found, but we want it to happen quickly, and I don't think we can expect a magic bullet. It's not going to happen in the next week or the next month or the next 6 months. We're really looking at a 12 to 18 month time frame. So that means that we at the bare minimum. So that means that the second one of herd immunity, as I mentioned to you before, I don't believe that in 1 year we'll get enough herd immunity. Maybe in 3 years we could get herd immunity, but again, that's a long-term view. So my view is that the most likely thing is, as has happened for previous pandemics, it will burn itself out. I actually think that's the most likely thing. That's what happened with the Spanish flu. It took 12 to 18 months to disappear, but it did. That's what happened with SARS and MERS. No one knows why. No one's prepared to tell us why, but that's what happened. So I think we need to be calm. We need to carry on. I think we're going to be using masks, hand washing and social isolation for the foreseeable future. I think the Prime Minister has had the right approach, which is to be calm, to contain, to suppress, to quarantine strongly, but we're not going to be able to eradicate this from the shores of Australia, because as long as people are returning home, as long as we continue to trade with goods from outside and have workers potentially transmitting it from overseas, we're going to continue to have low-level exposure to COVID. So the point about the quarantining is that's our first line of defence. The second line of defence is what we do in our community. So if we can get community transmission back down to less than 10% here in Victoria, it will be going back to where we were, which is aggressive suppression, containing outbreaks as they occur, and we'll be able to open up our economy and get back to work, get back to our normalities. The bad news is I think international travel is a way off. The good news is I think that we'll be able to get back to work and get back to an economy opening up sooner than later is my view. But then I am a bit of a deluded optimist. Hopefully I'm not too deluded and mostly optimistic. But I think that it's hard through the winter for us to feel positive. But if we can get these numbers down in the next week or two in Victoria, that will help us all feel a big sigh of relief. And I'm really hopeful that all of us together as Team Australia will get through this to the other side and we can get back to life as we know it.
Well, thank you, Katie. Thank you for offering us all some hope for the future. And can we all thank Katie for a great evening tonight.
Thank you, and thanks for your great questions. And as I said, we'll answer any questions via email or phone. Please let us know. But there's a lot of uncertainty out there, and our office remains open. We're here to support you. I'm your voice in Canberra. I don't have all the answers, but if I can find the answer, I'll get it to you. And please stay safe and well. We're thinking about you. We care about you. There are a lot of mental health support lines out there. If what I've said has made you anxious, my apologies. This is a worrying time for everyone, but a hopeful time as well. So good night, everyone. Take care. Stay safe and well.